I will be in Detroit for WATP. I have a bad taste in my mouth about last year.
Oh, don't tell me you're going back there again.
I am,
Oh,
but it's, hopefully, I mean, last year, two of my friends disappeared, and I thought they were dead on the side of the road in Detroit, and so I did a really shitty job on the stage, and I need to redeem myself. So, and it turned out they were just at the hotel fucking. I didn't know. I literally thought they were dead.
Yeah.
Because they weren't answering me. They just disappeared, and one of them, I had Life 360. We were linked up
Right.
on Life 360. That was turned off.
Oh.
So I'm like, okay. Someone has taken their phone and wiped it, and they're dead on the side of the road somewhere because it's Detroit.
But they were fucking.
I guess that's what they were doing. I don't know. But, we're in Ferndale, so it's a nice part of Detroit. But, still, you're from a country bumpkin like I am. You're in the big city, and, everybody's getting mugged and killed by them city folk. But it wasn't the case at all. But I didn't know that. And it was either that or they were so pissed off at me that they just cut me off. And either way, then my adrenaline was going. Most of the time, I don't get my adrenaline pumping at these things, but it was then, but that was why. And I just was very distracted and did a terrible job on the stage. And then they have an after party and stuff, and I just left because I was freaked out. I had to go find out what was
if they're
going on.
dead, there's nothing you can do about it.
Go to the after party and whoop it up while I'm worried about my friends. So, but anyway, there you go. But so I'm going. That is September 12th, which is my 2 days before my birthday. So I'm excited about that. Not that who gives a shit, when you're my age about your birthday. But I'm just saying.
So are we 85 this year?
No, I've been saying I'm 70 for a while because I'm close to it, but I'm 60. 69.
Oh.
Yep.
Big 7-0 coming up.
Yep, big 7-0 coming up.
Love it.
So anyway, all right. Very, very wonderful. Anyway, all right, let's answer questions.
Let's do it.
All right. Let's see here. Here's one from June 15th of 2015.
There you go.
Oh, wow.
It's a little bit late getting to this guy or woman, whoever it is.
Little edema in my lower legs and ankles.
Okay.
Left a lot of discoloration on the skin itself. I was wondering if there's any way to get rid of that because it's really dark, it's brown, it's really quite ugly. That'd be great. Thanks.
What's edema?
Yeah.
Swelling.
Oh, okay.
Yeah.
Okay, so what it sounds like he really has is brawny edema. That's a type of swelling that's characterized by a real dense, firm texture, and there's an increase in connective tissue, and you get thickening of the skin and hyperpigmentation. In other words, darkening of the skin. And it's similar to pitting edema. Now, normally, brawny edema doesn't leave impressions when pressed, but you can have pitting edema that leads to brawny edema. And, it's chronic. It's caused due to long-term fluid accumulation. So if you had pitting edema for a long time and swelling, and you get so much swelling in the legs that the skin capillaries can't feed all of that, and they get stretched out, and sometimes they die. And so you'll get, this can be caused by chronic venous insufficiency, not so much from opioid abuse. I don't know why he's thinking it's caused by using opioids.
Unless
just happened at the same time.
Well, unless it's caused some cardiac or some liver. I mean, if he's got fluid in his abdomen,
Well,
he's got heart failure, CHF.
Opioids don't do that so much either.
Well, listen.
If he was immobile for a long time or something like that, but normally it's just, bad veins.
Lack of inactivity.
Yeah,
certainly inactivity will do it, and lack of circulation.
Yeah.
Go ahead. Yeah.
But anyway, no, I was
Yeah.
just going to say, so the problem with that is that once the pigmentation gets into the skin from the damage to the blood vessels, you really can't get rid of it easily. I'm not aware of any. Do you know of anything?
Well, no, but I think the best thing is to reestablish good circulation in his lower legs,
Right.
and that can be done by a bunch of different ways. I hope that he's found those ways in the last 10 years, which would be things like physical therapy, lymphedema massage, a lymphedema specialist,
Yeah.
sports socks. Sometimes a vein specialist will have to go in and do some small procedures.
Sure. Or
for
compression therapy too.
compression
If he
therapy.
has lymphedema, which is caused by blockage of the lymphatic supply, you can apply compression.
Yeah.
And you can do that with venous stasis as well. They use these things called uniboots. It's a medicated wrap that's not elastic, and it will force some of the fluid out of the legs. But then, if you just take it off and keep doing the same things that you've been doing, standing up for long periods of time or sitting for long periods of time without moving around, then it just comes right back. Now, there are some topical creams that can get rid of pigment in the skin. Now, the pigment is actually caused by a molecule called hemosiderin, and it's just staining from the poor blood circulation. And these topical creams like hydroquinone or retinoids can sometimes lighten the skin and might get rid of some of that.
So it just makes your skin darker?
Yeah.
Oh.
Yeah. And it can be
Like a-
spotty too.
Okay.
Yeah.
Yeah, it almost looks like especially if you have really kind of paler skin, you'll have almost like a brown sock on.
Oh, okay.
Right.
Yeah, literally like a sock. Yeah.
Now, I'm looking at something right now that says laser therapy can target and break down the hemosiderin. So if you get the right frequency of laser, you might be able to, but you're going to have to go over your whole leg to do that. So I would definitely see a vascular specialist about this if you really want to do something about it. Of course, it was 10 years ago, so good luck with that. But there may be some people who have the same problem right
So
now.
the skin's not dead, it's just dark.
The skin is stained.
It's right. It's stained and it is damaged. It's thickened and damaged because when you stretch the skin out like that, the blood vessels that are trying to feed it can't force blood into that because it's under so much pressure now because of the stretching of the skin. And so the body's reaction to that is basically scarring, kind of.
Yeah,
and then
you're actually hyper stretching all the fascia and the components,
everything, right?
and the components of the skin. Everything gets stretched out of its normal, kind of.
And the body's
range,
reaction is to try to protect itself, is just to thicken that.
Yep.
And then when those blood vessels, the little capillaries start to burst and stuff, then you get that hemosiderin staining. At least that's my understanding of the mechanism of it.
Yep.
So exercise, elevating the legs, maybe trying compression therapy. I would start with the hydroquinone and maybe Retin-A or something, prescribed by a dermatologist. And if that doesn't do, then they could maybe try the laser thing if you're really worried about the appearance of your legs. Okay. All right. And glad you got off the opioids.
Yeah, yeah.
All right. Here's another one from June 15, 2015.